What's going on, everyone? Happy Wednesday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you had to take a test for flu, RSV, or some other virus, I hope you have tested negative for that as well. And if you did test positive, I hope you have a full and speedy recovery with no long-term and no long COVID issues. It is time now for the Wednesday edition of the Virus Update for Wednesday, November 20th, 2024. If you're new to my channel, this is where I do virus updates on all those viruses that can make us sick. Let's face it, there's a lot of different viruses out there. You need to be informed with what's going on with each and every one of them. It seems to be just about every day we find out something new with these viruses. H5N1 is one that we've been hearing a lot about lately, and it's something that is getting more and more concerning. Want to stay informed with what's going on with these viruses? I do updates here 2 to 3 times a week, and sometimes I do even pop in with those YouTube shorts when some breaking news story pops up that I need to just get out there and inform you about. So if you're new to my channel, subscribe down below, give this a thumbs up, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. Alright, yes, we are doing a midweek update this week because, well, I got quite a few things that I have found and that I want to share with you. And of course, there are some things that we still need to get to, such as more Walgreens positivity rates for some states. We need to take a look at emergency department visits for people diagnosed with COVID. And I do want to take a look at some wastewater data. And I found something in wastewater that, oh, it is not good whatsoever. You do want to stick around for that. I promise it will not disappoint. Well, it will disappoint you to see how high the level of a certain virus is somewhere in the United States. Where could that be? Stick around and you will find out. Starting off here in my state of Pennsylvania, a case of whooping cough confirmed at a high school. This is in I believe in Lower Merion Township, or excuse me, Upper Merion Area High School. So this is Upper Merion Township in Montgomery County, Pennsylvania. It's near King of Prussia, Pennsylvania. If you ever heard of King of Prussia Mall, it's near there. Trust me, there's a lot of viruses going around at that mall, especially at the holidays. But yes, there has been a case of whooping cough, otherwise known as pertussis, and it comes as whooping cough and pertussis has been going up throughout the United States, and Pennsylvania has been no stranger to the increase in cases. So this is just not good news. And now to this. This I thought was rather interesting. A report: 1 in 5 animals at zoo, this is in Brazil, tested positive for SARS-CoV-2, perhaps from people. So much like how we can have human-to-human transmission of COVID, animals potentially can get infected by humans as well. And this is not the first time we have heard about humans, or first time we have heard about animals being infected. In fact, it's happened in New York. We've heard about white-tailed deer. We've heard about several different ways that animals could be dealing with COVID. And in this particular study, it was from November 21st, or November of 2021 to March of 2023. So this is rather interesting. I'll make sure this study gets posted over on my website, datareport.info. I'll show you that in just a moment. Taking a look at this, infant RSV cases are on the rise in Dallas-Fort Worth, doctors say. Yes, this is not a good thing. During the week of November 10th, Children's Hospital doctors treated 366 cases of RSV. That's a 67% increase from the prior week. I know people hate me saying, some people just hate it when I say vaccines, vaccines. We do have a vaccine for RSV. If you can afford it, if your insurance covers it, make sure you try and get it because it's not a good thing. And also, this hospital system is also seeing an increase in walking pneumonia cases among younger children. So some things not good. We knew about the walking pneumonia. Now RSV is starting to see its rise for the colder weather months. Bird flu is now detected in the Netherlands for the first time in 2024. That's not good. And I should also add, we do have no new information on that child case in California. The best I can tell you is, or the latest I can tell you is, that it does sound like the child is recovering. Further testing by the CDC, examination is being done to see Just was it H5N1? And we'll talk about more about California in just a little bit. That's your hint for that wastewater site that we're going to show. My website, datareport.info. There's a lot of different information on here. Let's refresh this. There's a lot of different information on here. I archive stuff. I archive studies, papers, past famous people who have tested positive. I haven't worked on that in a while. Eventually I will get back to doing that once again. It's just a wealth of information. If you're trying to find something, you might be able to find it here. If not, maybe you will in the future. There's always constantly things being posted by me and other people. And remember, it is free to sign up, and it will always be free because that's the way it should be. Alright, taking a look now at air qualities across the United States. Let's refresh this. Let's see who has bad air quality. And if we do see bad air qualities on the West Coast, I'm not terribly concerned about that. You're seeing a big storm system that is coming into the West Coast right now. I mean, flooding in Northern California and Oregon is going to happen over the next several days. Just a huge storm system there. I am a little more concerned, though, about these air quality values in the east. That's not a good thing. From about North Carolina and South Carolina, straight on up to almost into New York State. Not a good thing. Hopefully that will clear. There is a front that's going to come through, and then there's going to be a big storm system in the northeast as well. All right, moving on now to this. You can follow me over at Climate Data Report. That's Climate Data RPT on X, or Climate Data Report spelled out the full way on Blue Sky. And here's my other YouTube channel, which is, let's refresh this. My other YouTube channel is Climate Data Report. Haven't posted a video there yet today. Hope to get one out later. We'll see if I have enough time to do that today. Taking a look at Philadelphia for EMS incidents, and on Tuesday, November 19th, they reported 720 EMS incidents. Now, the burbs right now, meaning suburbs, the counties just outside of Philadelphia in southeast Pennsylvania, last check just a few minutes ago, there were a ton of, oh my, yes, and there still are. So in Montgomery County, Pennsylvania, there are currently 19 active ambulance calls at the moment for EMS. Altered mental status, head injury, unconscious subject, vomiting, cardiac emergency, overdose, vomiting again, respiratory emergency, cardiac emergency, vehicle accident, head injury. On and on it goes. We're seeing a lot of vomiting calls. I'm wondering if norovirus is starting to rise there. We don't have wastewater scan sites for those particular areas. There's one in Chester County that's on there, but couldn't tell you if that's norovirus. And whoa, what is going on in Chester County, Pennsylvania? This is ridiculous. Unconscious person, respiratory difficulty, stroke, respiratory difficulty again, back pain, stroke again, falls, heart problems, respiratory difficulty again, falls, sick person again, syncope, seizures. Yeah, very busy outside of Philadelphia. I would be surprised if Philadelphia itself does not come in higher when I see Thursday's report tomorrow, because Montgomery and Chester County, Pennsylvania, were not this busy over the past couple of days, at least not when I was looking. And something else that we need to continue to look at going forward, and I'm going to be looking for more states, we're going to do it with Pennsylvania and New Jersey today, is hospital capacity. We're starting to come into the winter months where hospitals do get busier, and of course with all the buzz around H5N1, the problem with that is, if it did ever go pandemic, if it did ever go human to human, currently we don't know if it is or not. They're saying it's not. We just don't know that because there's unexplained cases popping up. If it did, would the hospitals be able to handle that? And unfortunately in eastern Pennsylvania, you're seeing a lot of yellow here, but not all of it is because the ER is full. Some of it is for behavior health, but we do see today, or at least I'm noting here, that in York, Pennsylvania, WellSpan, York, is reporting that the emergency department is overcrowding. That's one I have not seen pop up lately, and I'm also seeing another one here that I have not seen recently. Where is this at? This is St. Luke's, Geisinger, and Orwigsburg, Pennsylvania. That one is overcrowding at the moment. I did see another one out that way. See, some of these are for behavioral health issues, but again, and here's one that just constantly shows up. It is St. Luke's in Monroe County, and part of their problem is that the population in that area has continuously been going up. And the Lehigh Valley, Pennsylvania, they have various different issues. Another problem up there is that part of Pennsylvania is experiencing a population increase. But overall, look at this. A lot of emergency departments that are diverting. Look at this one. Emergency department at capacity at St. Luke's, Upper Bucks County, Quakertown. That area has also seen a population increase. But again, with more people developing long COVID and post-COVID issues, more people are needing to use hospitals. So the healthcare system is unfortunately taking on a new level of strain that they have not seen before or have not seen in a very long time, at least not in my lifetime. All right, moving on now. Here's the 15-day trend map for Pennsylvania for COVID, and this is just, it's showing that there's no change or decreases. I actually have not had time to go through each of these, and as I have stated in the past and found in the past, oftentimes this map does not match up with what the charts are showing here. I'm just going to click on one of the sites now and see what happens. And looks like I'm getting selective. Yeah, it looks like I'm getting some issues here. But the point is, oftentimes in the past, when I would take a look at these charts here, they would not match what the colors are showing on the map. Moving on. The COVID viral activity level in Canada is moderate. Flu A is low. Flu B is not detected. RSV at this time is listed as moderate. Let's take a look at some of those COVID positivity rates from Walgreens around the United States. And we'll start off in the West since we just gave a lot of attention to the East. Washington's positivity trend is 21.7% for COVID. The prior week was 20%. Difference of up 1.7%, but testing is down. 46 versus 55 test. In Idaho, the positivity rate is 15.4%. The prior week was 22.2%. That's a difference of down 6.8%. Total test, 13 versus 9. Arizona, that's a state we don't get a lot of data out of Arizona. I wish we would get more. I'm going to have to search and see if I can't find a dashboard for Arizona. Is there still one? If there is, let me know down below. Arizona's positivity trend for COVID, 27.7%. The prior week was 30.2%. That's a difference of down 2.6%. Total test, 264 versus 172. I'm seeing red in Kansas, so let's investigate. Oh my, I'm also seeing an increase in testing. 19.5% positivity rate there. The prior week was 10.7%. That's a difference of up 8.8% with testing being 41 versus 28. Yeah, that's not a good thing. That's not something we should be happy about. And oh, Minnesota, this is not good either. 19.7% positivity rate versus 14.9%. That's a difference of up 4.8%. Total test, 76 versus 47. It's up, so that means your cases there and the cases in Kansas are likely starting to rise. What's going on in Mississippi? I'm seeing an increase. Yeah, this is not good. 19.4% positivity rate. The prior week is 11.5%. That's a difference of up 7.9%. Total test, 36 versus 26. Your cases may be starting to rise. Can we look at Texas? Yes, we can. The positivity rate for COVID in Texas is 9.5%. The prior week was 9.6%. That's a difference of down 0.1%. Total test, 766 versus 664. Let's take a look at New York State. New York State is 23.2% versus 25%. That is down by 1.8%, and testing went up. So that's some good news. 142 versus 132 tests, and we'll do one more state. North Carolina, 9.9% COVID positivity rate versus 8.4%. That's a difference of up 1.5%. Total test, 213 versus 215. And did we do the national level? I don't think we did. Nationally, 13.5% COVID positivity rate versus 13.2%. That's up 0.3%. And testing was up a little bit. 4,244 versus 4,009. I would like to see by the end of the year, Christmas time, over 10,000 tests again. Can we make that happen? I think we did in the summer wave. And of course, you know, if it's over 10,000 tests again, that means there's a lot of people that are sick. The KPE 3.1.1 variant is currently the variant in the lead at 52%. XEC is at 28%. XEC is slowly still rising. We'll get a new update on it on Friday. All right, let's take a look at some wastewater data. I've left you in suspense. I'm sure you want to see this. I'm sure you want to see how bad things are for influenza A in Los Angeles, California. Yes, this is not good with all the hype and buzz about H5N1 and bird flu. Look what we're seeing here. So here's influenza back in 2022 going into 2023. You see where it peaked here. Then here's what it did in 2023 going into 2024. Take a look at what we are currently seeing in Los Angeles. And no, it's not one of those wonky movements. 1 update, 2 updates, 3 updates, 4 updates, 5, 6, at least 6, 7, at least 6 or 7 updates, maybe more, have gone literally almost straight upward. Now we are starting to see a downward trend in the most recent update. Let's zoom this in a little bit to make it easier for you to see. But you get the point here. There is a massive amount of influenza A being picked up by wastewater in Los Angeles right now. Higher than the past couple of years since this chart has started. Not a good sign, and I think someone ought to find out just what the heck is going on in LA right now, because this is not good whatsoever, and it is a huge red flag. I just tweeted this chart out over on X, and I posted it on Blue Sky as well. If anyone has any answers as to why this may be happening, please let me know down below. One can only hope that bird flu would not be a part of the equation here, but who knows? It is not a good thing. Take a look at some of the other levels. RSV is still low. COVID at this time is not much of an issue yet. It is rising or was rising ever so slightly. HMPV is still low, but again, influenza. Take a look at that, and let's take a look at norovirus where we're at it too. Norovirus is starting to rapidly go up at this wastewater site, so that's not good to see. Nationally for COVID at this time, take a look. Things are actually dropping once again. Pleased to say that. RSV is still low, but it is rising. And influenza A nationally. Take a look at this. Yes, it is starting to rise, and I did take a look at that chart. It's still not as high as it was last year. It's going up, but we'll have to see if it ends up higher than last year. That is the wild card to be watched. Influenza B at this time is very low. HMPV is still low, but rising. Norovirus is fairly high still. But the last update, which does look like a wonky movement, did drop some. We'll have to see if that gets updated. And real quickly, just for the heck of it, let's look at the West Coast region of this. COVID, medium, still dropping. RSV, dropping again. Yeah, influenza A in the West Coast. It's really rising at this time. It's going to be listed at medium or high relatively soon, should that continue. Influenza B, not much of an issue. HMPV, not much of an issue. Norovirus at this time is listed at high. Alrighty, moving on now. Let's take a look at emergency department visits diagnosed with COVID. Just going to go through this quickly. We're not seeing too many concerning things here just yet. Nationally, emergency department visits with people diagnosed with COVID showing up at the emergency department are still dropping. Alabama is dropping. Alaska is kind of bouncing off the bottom. Most recent update shows a drop. Arizona looks like you were rising a little bit. Arkansas is dropping. California starting to level off. You may be starting to rise pretty soon. Colorado, same deal with you. You may be rising pretty soon. Connecticut was starting to rise, then you started to drop again. Delaware, kind of bouncing off the bottom. DC is low. Florida, at this time, still dropping. Georgia still dropping. Guam is low. Hawaii, no issues yet. Idaho, you're kind of leveled off now. You're not dropping anymore, but you're also not rising. Illinois looks like you're starting to level off as well. Indiana is still dropping at this time, ever so slightly. Iowa, looks like maybe you're still dropping, or maybe you're just leveling off. Kansas, at this time, yet again, does look like maybe the start of something in Kansas. Kentucky is, again, leveling off. Louisiana, we're seeing a lot of states where it's just leveling off, where will it continue lower, or will it start going up? And Louisiana may be one of those states soon as well. Maine was dropping. Now it looks like that drop is stalling. Maryland still dropping. Massachusetts still dropping. Michigan, it was still dropping slightly. We'll have to see if that continues. It may be leveling off. Mississippi has leveled off. You're not going up or down just yet. Montana is still dropping. Nebraska looks like you're bouncing off the bottom. Nevada has stalled. You're not rising or dropping. New Hampshire's starting to rise a little bit. New Jersey, you might still be dropping. New Mexico looks like it started to rise, then it went back down a little bit, then it stalled. New York is still dropping. North Carolina, still dropping. North Dakota was going up, now it's dropping again. Ohio is still dropping. Oregon is starting to stall. Pennsylvania is still dropping slightly. Rhode Island still dropping. South Carolina, it looks like it's ever so slight drop. I mean, not even dropping that much. It's more so just stalled on the bottom. Uh, South Dakota, you're bouncing up and down a lot. Don't know what that's going on there. Looks like it's hard to say what's happening there. Tennessee at this time looks like you were stalled and then dropped a little more. Now you're starting to stall again. Texas, I'll say it's still dropping slightly. Utah, you may be starting to rise a little bit. Vermont is definitely still dropping. You got hit really hard with the summer wave. Virginia is still dropping. Washington, looks like that drop is starting to slow down. West Virginia is starting to drop once again. Wisconsin still dropping. And unfortunately, nothing from Wyoming. And also, I don't think we mentioned Missouri today. Were there any other states that we did not mention? I don't think so, but yeah, there's some states that just do not update. All right, in New Jersey, it looks like everything, for the most part, is normal. We're seeing some of these specialty issues, and we're also seeing RWJBH, RWJ University Hospital. It looks like emergency department status is listed as red for adult emergency department, and university hospital looks like they are having some sort of an issue at this time as well. That's in New Jersey. In New York State, we do note here that the cases are a little bit higher than the previous day's report. 320 cases reported, and it also looks like the hospitalizations today, compared to yesterday, did go up slightly. 414, and in the ICU, 50 at this time. It just does look like to be the first day that the second day of a reporting week went up in quite some time. So that's something we'll have to keep an eye on. And it's only a matter of time till we start to see the upward trend in New York State. But hey, it's starting off really low. 414 people in the hospital. That is a really low number. And it is also good to note that to start the week, 411 was lower where they started the week last week, though higher where they ended the week last week. So some good news on that, but unfortunately that start of the potential upward, it could be coming soon. If it doesn't start this week, it'll likely start post-Thanksgiving. I would be shocked if we don't see more rises in many states post-Thanksgiving, and that just doesn't go for COVID. That goes for all these viruses, because you're going to have a lot of people gathering together, and when you have a lot of people gathering together, that does unfortunately lead to infections of various different viruses. Alrighty folks, that does it for the Wednesday virus update. I'm thinking the next update is going to be Saturday versus Friday. Stay tuned to my social media. Of course, if anything big pops up, like a big breaking news story, I'll do one of those YouTube shorts. And until I see you again on Saturday, stay safe everyone, have a fantastic day, and remember, if you're new, subscribe down below. Give this a thumbs up if you liked the video, hit the notification bell, share this video with anyone you know, and leave your comments down below. I will see you all again on Saturday. Until then, stay safe and have a fantastic Wednesday afternoon. Thank you for watching, everyone.